Hello and welcome to AdvocateLive, where we're answering your questions from some of the world's leading health experts who are a part of the Advocate Healthcare family. I'm your host, Stephanie Johnson. So if you are watching us right now on Facebook, you can post a question for today's show by clicking the share button. If you're checking us out on Advocate's webpage, just click submit a question. Today, we are delighted to have with us Dr. Mark Neault, orthopedic surgeon and sports medicine specialist at Advocate Condell Medical Center's Orthopedic and Spine Institute in Libertyville, Illinois. Dr. Neault is answering everything you want to know today about sports health and safety. Dr. Neault, thanks so much for joining us today.
Thank you for having me.
Sports health and safety, popular hot topic. We received tons of questions before the show even got started today, and we got so much to get to. So are you ready to get started?
Let's get at it.
All right, so before we get started, tell us a little bit about how long you've been at Advocate Condell Medical Center and a little bit about your practice.
My practice is complete orthopedic care in Lincolnshire, Illinois. I've been on staff at Condell for 11 years now.
Wow.
And so we have various specialties represented within orthopedics in our practice.
All right, so let's kick off. We're going to start with aches, pains, and injuries. We got a lot of questions in around that. And the first one comes from Elvia. She says, her question is, she started walking for exercise, but now her knees are beginning to hurt. So is that an indication that she should stop, or should she see her doctor?
Knee pain is fairly common, especially if you're newer to an activity, so you may want to assess how vigorous your activity is, what your starting condition level was. You could try some anti-inflammatories, maybe take a little bit of ice, take a little bit of rest and see what happens, but it doesn't immediately mean you need to take care of it, but if it continues, I would see your doctor.
So key there, aggravating you, kind of watch it, and if it gets worse, see your doctor.
Yes.
All right, let's move on. We had a question come in on Facebook from Yolanda, who says, is surgery always necessary for a torn rotator cuff? Can you tell us what that is and if surgery is always required for it?
The rotator cuff is a cuff of muscles that surrounds your shoulder. So if you have a shoulder like this, the ball and socket of the shoulder, there's a cuff of tissue, forms almost a circle around the shoulder to be able to move that around. And that's your rotator cuff. It rotates the shoulder. So tears of the rotator cuff can be of various types, and that would determine the treatment. Degenerative rotator cuff tears, which are one of the more common tears that we see in the 5th and 6th decade of life, don't always need to have surgery.
Got it.
Some of the more traumatic tears that strike the younger patients and athletes, those do often require surgery. They tend to get worse over time.
Okay, so good information to have there for Yolanda. So I have a question that came in on our webpage from Calvin. He says he's in the early stages of what he calls joint swelling, and he wants to know if he needs to seek further medical attention for that.
Joint swelling is one of those things that gets my attention a little bit.
Okay.
Joints aren't really supposed to swell. So the first thing I would ask is the joint really visibly swelling, or does it just feel like it's swollen? Some people will misinterpret tightness for feeling like it's swollen, but if it actually looks swollen and there's fluid in the joint, you should probably see your doctor.
Okay, so you gotta be able to know tightness to that visibility. What you see can tell you whether or not you need to get some further medical advice.
Yes.
Like that. This next question, a really good one, and one that's probably really popular, came in from Kristen on Facebook, who says, with an ankle sprain, which are pretty common, is it better to tape or brace?
Taping and bracing serve similar purposes.
Okay.
Taping tends to be a little difficult to do well on your own. You're at risk of tape cuts and other issues. The tape also can stretch out over time. So if you're going to do it on your own, I'd recommend a brace. It's easier to apply consistently. If you have access to an athletic trainer who's able to tape in the correct way, then I would certainly go that avenue if it's available. But I would also ask yourself, should you really be wearing that brace all the time or that tape? Maybe there's really something else that needs to be addressed.
Okay.
And people with recurrent ankle sprains and ankle issues, you usually need to do a little bit of a rehab program and do some strengthening of that joint.
All right, because that's pretty common. You see people out at the gym always taping or bracing, so it's, you know, if it's something that you're having to do all the time, go see your doctor.
Yes.
All right, so another question, and I hope I get this right because I want to do Eva proud here, who sent in a question, who says she has what I believe is Sesamoiditis. Am I saying that correctly?
Very good.
She wants to know what causes this and what can she do to get it treated.
So sesamoiditis, it's inflammation of the sesamoid bones.
Okay.
So we have sesamoid bones in different parts of our body, and they usually live in or around tendons. So those can become inflamed like anything else,
Okay.
and that's called sesamoiditis.
Wow.
So sesamoiditis could be treated with anti-inflammatories, with ice, activity modification, backing down what you're doing, and really paying attention to shoe wear, making sure you're wearing good shoes for the activity you're doing, maybe even adding an insert to that shoe. It's very treatable.
All right, very good information. And just segue in there, you mentioned ice there. This next question from Tori, which is a popular one. We've had a few people send this in already. What is better, icing or heating an injury?
They're both very good.
Okay.
Depends upon the setting.
All right.
Ice is good for the acute injury. So the day of, the day after, a couple of days after, I would always reach for ice. Ice helps to lower swelling, decreases blood flow to the area. Heat plays a role too. Outside of 72 hours, chronic issues, heat often feels better.
Okay.
Heat helps to increase blood flow to the area. And you can even use the two together. This is what the athletic trainers do very regularly with the athletes to flush the area out. But always, if you're in doubt, probably reach for ice.
Okay, so ice first, but it doesn't hurt to have both.
Correct.
All right. So I have a question in from Leah, who's asking a question on behalf of her brother, who has a torn ligament in his knee. She is asking, how serious are these tears and how can they be treated?
It kind of depends upon the ligament that's torn.
Okay.
So not all ligament tears are terribly serious. If I reach into my little bag of goodies here, I have a model of a knee.
Got it.
And there's an example of a medial collateral ligament tear here on the side of the knee. That'll heal on its own or with a brace and with time. That rarely needs surgery.
Okay.
But if we dive deeper into the knee and look at structures in the center of the knee, like the anterior cruciate ligament or the ACL, that often requires surgery, especially in a young active person. So you really need to clarify what ligament it is, and it could be okay, it may need surgery.
Oh, okay. Well, so now that you had that knee model out, I want to ask a question. I'm going to jump in the show here. My husband, Mario, he's in his 30s. He just had a surgery, torn ACL, a little bit of torn meniscus, and it's been 8 months ago, but he still has a lot of stiffness. Is that common? And he thought he'd be 100% and not so much.
Joint stiffness is common, especially after surgery. It depends upon what we do in the joint. If we're doing a major repair or reconstruction, I would certainly expect stiffness. Now, stiffness can vary from joint to joint, and the length of time can vary. 6 months, no big deal. Could even last up to a year. Unfortunately, the tincture of time is what helps. Unfortunately, there's various factors, what we did inside the knee, how old the patient is, et cetera, that will determine the length of time.
Well, he's watching right now, so age matters.
Age matters.
He's no spring chicken, I tell you. Okay, so next question. I've heard this a lot, but I actually don't know what it means necessarily. And Dominic says he has it. It's called tennis elbow, and he wants to know, how serious is that? What is it?
Tennis elbow, most people don't play tennis that get tennis elbow.
Okay.
It's just called tennis elbow. It is inflammation on the outer side of your elbow of the tendons that attach there.
Okay.
Golfer's elbow is inflammation of the inner side, the tendons that attach there. So it's an inflammation, it's an itis, it's a tendinitis, and it is usually created by repetitive stress, repetitive injury. The first thing you want to do is try to figure the source out. If you can figure out if it is tennis, do you have the right tennis racket? Are your swing mechanics correct? If it's not tennis, if it's a work-related injury, what are you doing? Maybe you can modify that. There's braces that help, anti-inflammatories, and stretching that can help as well.
Okay, so just because it says tennis doesn't mean you have to play tennis to get it.
Correct.
All right, I get it. I feel smarter already. Okay, so a few ladies have sent in some really kind of women-focused questions, so I'm going to delve down that path. So Diane says, do you have advice for women when it comes to starting a weightlifting program? Is there a difference between women and men?
Well, there's no difference between women and men. It depends upon the goals.
Okay.
Really, I have patients that are competitive bodybuilders and lift far more weight than I will ever lift. But in general, most of my female patients are looking to achieve either toning or weight loss. And that should be different than, in general, a man who's trying to put on a lot of bulk. So you want to be more like resistance type training, maybe lower weights, higher repetition kind of thing. But it's not that women can't lift heavy weights if they choose to.
Okay, but if you're starting and you haven't lifted before and you're picking up this new exercise regimen, is it good to just kind of check with your doctor, make sure you're okay?
Yeah, that's something for your medical doctor to look into to
Okay.
make sure that you're really okay to get started in any sort of an exercise program.
All right, moving right along. Lori says, when it comes to weight training, is it better, we just tackled the weightlifting issue, is it better to just use your own body weight? Is that good?
Resistance training with your body weight is very good.
Okay.
In general, it can be a little safer to do. It can be a little easier to do at home. Swiss balls, Bosu balls, there's other ways of doing it on a bench. Resistance training in general is very effective.
Okay.
Weightlifting is okay too, but it can be a little more dangerous if you're not careful about how you do it.
Okay, very personal question just came in. I like it. Kayla, thank you. Who sent in on Facebook, who says she kind of has wide hips, and she notices when she bends down to pick up something that her hips pop or crack, and she wants to know if this is something she should ignore or something she should talk to her doctor about.
Joints can pop and crack sometimes.
Okay.
The hips are one of them. It doesn't always mean bad. So my advice would be is if it's not painful, keep an eye on it. See how it does, what the pattern is, how often it happens, how long it lasts. And if it starts to get painful, or if it is already painful, that's when I would seek help.
All right, very good advice, Dr. No. And we're going to move into another popular segment here called kind of some questions about youth when in sports. And we have a question in from a mom, Brenda, who sent this in on our website, who says she hears so much about concussions in young sports, very hot topic, and that her son plays high school football and he's already gotten a concussion. So she's worried mom here, and she wants to know what are the dangers of her son having multiple concussions.
Concussions, very hot topic, very big topic.
Yes.
Concussions in general are very serious, and they really need to be tended to with great care. You want to make sure to identify the concussion first of all, and then you want to make sure to rest that athlete and make sure that they are completely symptom-free. And in some cases, they need to be symptom-free. They may miss a month of sports. Once an athlete's had a concussion, they are at a slightly higher risk of getting additional concussions. But there's precautions that can be taken as far as equipment, especially in a contact sport like football or hockey, where you can wear the correct helmet, the correct chin strap, the mouth guards can help. There's protective measures you can take that might make a difference for you.
All right, and then just to delve deeper into that question, you know, when it comes to kids, they try to be pretty resilient and get back out there because they want to get back out there. But what can a mom do to watch to make sure, even if her kid says he's okay, that she kind of can feel comfortable that he's okay?
Well, there's specific tests that can be done by a trained professional.
Okay.
Athletic trainers who might be at the side of the event are trained in doing this, as are many physicians. But mothers know best sometimes.
Okay.
There's things that can change in an athlete. Their demeanor, their focus, their irritability, they just don't seem right.
Okay.
And if that's the case, they probably have that fog that people used to talk about, getting your bell rung and things are a little foggy.
Yeah.
And so if that's the case, then they have a concussion.
Okay, so it's good mommy intuition.
Yes.
All right. Alice sent a question in on Facebook, pretty common question. What is an overuse injury, and which sports are most likely to give you them, or are they just common in general?
Overuse injuries. Tennis elbow fits into that category.
Okay.
Plantar fasciitis, Achilles tendonitis, a lot of inflammations, tendinitises are overuse injuries. Overuse injuries are just what they are, they're overuse. So too much of a good thing. Too much tennis, too much golf. I know it sounds like that's not possible, but it is. And you want to really kind of take an assessment of what you're doing activity-wise. It could be a work activity. You just want to make sure that you try to get to the bottom of the source and kind of try to pace yourself a little bit.
Okay, so get your Tiger Woods on, but do it, kind of take a break. Okay, I get it. All right, very good. Okay, next question in from Adam, which I think is great. He says his son is 9 years old and already wants to play tackle football. Is he too young?
Contact sports, very concerning for parents. They're okay. I'm a big fan of hockey and football. But I do think that precautions need to be taken. I think that football does a very good job of stratifying the kids by body weight. I would caution parents who are trying to push their child up the ladder faster. You don't want a 50-pound child playing against a 100-pound child. So you really want to respect the divisions of football as they are.
Okay.
And then you want to pay attention to the equipment.
Okay.
Equipment is not a place to cut corners. Luckily, most football programs provide the equipment. You want to make sure that a coach or somebody is fitting the equipment properly.
Got it. So kind of slow it down, let him play with his kids his own age and weight range.
Yes.
All right, so believe it or not, we're already at 15 minutes in, so I'm going to do a just quick pulse check with the audience. And if you are just joining us for the first time, we are talking with orthopedic surgeon and specialist Dr. Mark Neault, who is answering everything you want to know today about sports, health, and safety. If you can join the conversation right now by clicking the share button on Facebook, and if you're watching us on Advocate's webpage, just click submit a question. We'll get back at it. I have the next question that came in from Tom, who says, who's asking, are x-rays always needed when it comes to a young person having an injury?
No, not necessarily.
Okay.
I would take into mind how the injury happened, what the source of the injury, was it severe, was it minor? Can the child or athlete bend or move that joint? Can they step or walk on that joint? Can they bear weight? If they can't, those are reasons that you might want to get an x-ray, but they're definitely not universally needed. Okay,
next question. Good, that's great information, Dr. Neault. Jack, which I think this is something that touches on that's right in the mainstream media here. He says his son has energy drinks before his big games all the time, and he's heard that they can be bad for you. Do you have any advice or some alternative options that you would recommend?
Energy drinks are not a good idea.
Okay.
I am a fan of sports drinks in the right setting, but energy drinks that contain caffeine are a diuretic. So first and foremost, they're going to actually deplete the fluid inside your athlete. So that right there is the number one reason not to consume energy drinks during or before sports. The energy drinks also have quite a crash that can be associated with them, where the athlete will lose a lot of energy very quickly.
Okay.
So I'm a big fan of hydration. I think that maintaining hydration is very important. That helps maintain energy level right there.
Okay.
And then sports drinks in the right setting. If it's hot out, if the child's losing a lot of sweat, it's a very vigorous activity.
Okay.
There's some controversy about the sports drinks, but again, when done in the right setting, I think they play a very important role.
Okay, very good information to have. We're going to move on to a few seniors have sent in some questions. This one's from Linda on Facebook, who says she's in her 60s with mild arthritis in her knees, but she continues to work out. She's very athletic, apparently. She works out 4 to 5 times a week. Is it time for her to slow it down a bit?
No,
okay.
Not necessarily.
All right.
But I would assess what your activity is. With arthritis, you're going to want to stay to lower impact type activities. So step aerobics is not going to be a very good activity, and running won't be. But there's many other activities, from walking, power walking, even biking, swimming, and then certainly weight training, that are very safe and fine to do with knee arthritis.
Okay, very good. And we know that osteoporosis or osteoarthritis can come with age at times. And Michelle wants to know, can you develop osteoarthritis from playing certain sports, and what causes it and how is it treated?
Osteoarthritis, there's actually no definite correlation between arthritis and activity level.
Okay.
So I get asked by runners all the time, and I can point out runners that are in their mid-70s that have been running their whole lives and they have no arthritis at all in their joints. There's a big hereditary component to arthritis.
Okay, got it.
And a lot of arthritis that we see in our practices are often a post-traumatic arthritis as well.
Okay.
So somebody who tears their ACL or their meniscus years down the line may have some arthritis in the joint.
That's great information. So it could be hereditary. Who knew?
Correct.
So it doesn't matter which side of the family, mom, dad.
No.
You could just no determination. You just could develop it. Very good information, Dr. Neault. Moving on, Ed wants to know. He sent in a question on Facebook. He said he's played hockey when he was younger, but he's not skated in a while, and he wants to get back on the ice, but he doesn't want to risk hurting himself, getting a hip injury. He's older. So what advice would you give Ed?
Hockey's a great sport. It's a very intense sport. There's a lot of cardio effect that goes with hockey. So the very first thing I would say is see your medical doctor and make sure that you are in condition to be able to handle that kind of cardio stress. There's usually not a lot of contact in adult league hockey, so I wouldn't be worried about breaking bones quite as much as I would just be worried about somebody overexerting themselves. But it's very safe and fine to do.
Very safe. Okay, awesome. So Ed, there you go. You can get out there and skate. Just be careful. All right, so here is a question which I think is a really great one from Kevin sitting on our website. He wants to know, how important is it to stretch before exercise? We always hear this about stretching. Is that important?
Stretching is very important.
Okay.
Flexibility is one of the best ways to prevent injury.
Okay.
So this is something that adolescents struggle with, men certainly struggle with, often more than women. But rolling with those foam rollers that you can buy at the store is also very helpful.
Okay.
And somebody can maybe show you how to use those. Stretching is very effective.
Okay, so that is good information. And I'm going to ask another question that's a pretty common one, and this one came in from Jerry. And he's talking about running and it being, you know, this whole kind of common, you hear, I don't know if it's true or not, that can be tougher on your knees than brisk walking. Is that true? And is there any sports that's kind of just better for your knees than another?
Running is a fine sport,
Okay.
but on a normal knee that's able to handle it, running can be very good.
Okay.
The important thing I'd pass on all the runners out there, and many of them already know this, is their shoe wear. Make sure that the shoes are up to date and that they fit correctly, and even sometimes an extra insert's required in the shoes. If you already have an injured knee or already have an issue in your knee, then running is not a great idea, and that can accelerate wear and injury.
Okay, very good information to know, and this one segues right into a next question who came in from Sylvia, who says she has extremely flat feet, and she wants to know, can she still start a running program, or should she not? Now, a common theme today has been shoes,
Yes.
proper shoes. I'm
Yes.
thinking you're
Yes,
going to go there.
Absolutely. I mean, shoes are key, and there's all kinds of running stores out there that do a very good job of fitting people with shoes based on their foot style and shape. And then inserts. There's even cheaper $30 to $50 inserts that can be put inside of the shoes. They don't have to be the very expensive orthotics always, that can keep somebody like her running as opposed to on the sideline.
All right, so shoes, what you put on your feet, no matter who, flat feet or not, very important.
Yes.
All right, so Anna, go Anna, who is running, prepping to run the Chicago Marathon this fall, and she wants to know, what things should she keep in mind to avoid injury when she's running?
The most important thing, I think, is cross-training. It's
Okay.
a term that came out in the 1980s that includes strength training, cardio training, and flexibility. Runners tend to do nothing but run, and running is fantastic. I enjoy running myself, but I think that it's a good idea that there's off days. The mileage is paced out correctly. You ramp up into that higher mileage at a very gradual pace over weeks and even months. And you, as I said, take some time off and maybe even do a different activity once in a while, like get on a bike or take a swim.
Okay, very good information as Anna preps there. I have another question, which I think is very interesting because we talked a lot about just general things like the advice you gave Anna to prepare, but how important is just eating right, having a healthy diet to maintaining your girth, or your flexibility, or your whole just being a really good specimen. Is that important?
Very important. Nutrition is very important. Nutrition is important to healing. Nutrition is important to growing, to developing. Your body is a machine, and you need to put the proper fuel in it. And so I would be very careful about what your diet includes. If you have questions, certainly ask your physician. There are supplements out there which are safe to take.
Okay.
If they're the correct supplement, I'd be careful of some of the internet and things that are out there, and make
Got
sure
it.
you research the product, know what's in the product, and then you should be safe.
All right, very good information, and I like this question, which is very topical, in from Rachel. Of course, this week has been a scorcher here in Chicago, Illinois, topping 106. But when you're a person who exercises avidly, that doesn't slow a lot of people down. So what's the best way for someone who's going to get out there no matter what, stay hydrated?
Fluids before the activity,
Okay.
during the activity, and after the activity. Really, in general, some good guidelines are drink a pint of water beforehand, drink about a half a cup to a cup of water for about every 20 minutes of exertional activity, and then in your cool down period, drink about another pint of water again. So water intake is very important. This is a role for sports drinks too in these high heats sometimes.
Okay.
And dress in layers. If it's going to be cooler at the beginning of the day and then as the activity goes on it's going to get warmer, you can shed some layers as well.
Okay, we are almost out of time, so I'm just going to ask you a couple of questions before we try to wrap. Wow, we've gotten a lot in, and I'm going to take this question, which I think is really good, from Marianne, who says she always hears, and I do too, your core is so important to maintaining balance and everything else. So how important is that to have that core strength that you always hear people talk about in gyms and on exercise tape?
Core in general is referring to your abdominal muscles, your back muscles, your core mid-body strength. And it's very important. It's certainly very popular right now because it's for good reason, because it helps to keep people going. It helps to prevent injury too.
Okay, that's great information to have. And I just want to get this one little one in, maybe you can squeeze that, and then I'm going to ask you some tips that you want to leave us with today. Kent says he has what's called trigger finger. I've never even heard of that. What is that and how is it treated?
Trigger finger is a snapping of a tendon in the palm of your hand, and there's little pulleys in the palm of your hand where these tendons travel through, and it's on the flexor surface of your hand, and as you move your finger up and down, that tendon will catch inside of that pulley and will trigger.
Okay.
And it makes even an audible snapping in some cases. And actually a cortisone injection is pretty helpful for that, and in some cases it requires surgery.
Okay, so he should see his doctor if he
should see somebody.
Okay, all right. So Dr. Neault, as we get ready to wrap here, can you give me, give the audience, 3 or 4, I mean, we've gotten a lot, you've given us a lot of great information, a lot of great advice for those who've written in questions. So tell us what you want us to remember. Top 3 things, key takeaways from today's show.
Important things to me are consider your starting point, consider your goals. What are you going to be trying to do, whether it be a sport, what level you're going to try to play at? Are you going to try to play at a collegiate level? Are you going to try to lose weight? Are you going to try to just tone yourself? I think having realistic goals in mind is very important, including your general physician in on these decisions to make sure that it's healthy for you. And for any sort of a sport that requires equipment, a contact sport, making sure that the equipment is correctly fitted, and even for a runner that their shoes are correct, as was a recurring theme.
All right, so 3 things. The starting point key, shoes, you said it throughout, they are important, and get fitted for the proper equipment. That's all key. And we didn't get to a number of questions that came in, but no need to fret. There is a sports injury prevention talk coming up soon at Condell. Can you tell us a little bit about that?
Yes, on August 1st at 6 p.m.
Okay.
At Advocate Condell in Libertyville, it's going to be a sports injury prevention panel discussion. It's going to be designed for parents and coaches. Athletes are certainly welcome to attend. And we'll be there to give some basic information ahead of time and then answer all kinds of questions.
What time is that starting?
6 p.m.
6 p.m. Okay, so that they can get more information from you and even some coaches. Dr. Neault, thank you. It's been so great having you on the show today. Lots of wonderful information that you share with us. So thank you.
Thank you.
That wraps up this edition of Advocate Live. Thank you so much for watching us and joining the conversation. Remember, you can text the word Advocate Live to 8444 to receive regular alerts about upcoming chats. Also, you can connect with us anytime on Facebook, YouTube, or at advocatehealth.com. We will see you next time. All right, thanks.